Hello and welcome back to Breakout Session 2. We hope you had a pleasant break and we're delighted to have you back for the next part of our day. Here on stage 1, we welcome Dr. Ian Buckle, who will talk about making the most of an intraoral scanner. Dr. Buckle has over 30 years of experience in general practice, both in the private sector and with the National Health Service. The focus of his practice is comprehensive reconstructive aesthetic and implant dentistry. His lecture here looks at how to get started with digital dentistry and explores the advantages of using an intraoral scanner. Welcome, Dr. Buckle.
How's that now? Are we okay? So without further ado, I would like to get started on this afternoon's lecture. Hopefully everything is in good order now. It would appear the screen is on, so hopefully we can get started on this. Just in case you didn't hear me before, just said thanks to everyone for being here. Really appreciate your time and hope you're going to get something out of this next hour. I'm going to try and make it as interesting and as informative as I can for you. So this afternoon, we're going to talk about making the most of your intraoral scanner. Really what I want to talk about is how I use my scanner all day, every day, so you get that return on investment. It's a big piece of kit, a lot of money to spend, and very often we see it just associated with big treatments or fancy treatments or whatever, and maybe as general practitioners we don't think that it's particularly for us. What I want to share with you is how I'm going to be using this all day, every day. I use it during examinations to communicate and engage with patients. If they're engaged and we want to move forward with treatment, I use it for taking records. We use it for making splints, which is an important part of my practice, to stabilize bites. We use it a lot in restorative dentistry. I want to touch on how we're using it for orthodontic purposes. Obviously, we use it to communicate with our orthodontist, and also for some GDP orthodontics that you would do in your practice. It also has made implant dentistry so much easier, from the planning stages and again from communication with our implantologist colleagues to the restoration part of what we do. It used to be not a dread of mine, but it was also it was always a difficult thing, trying to take impressions around implants. Now with scan bodies and digital impressioning, it really becomes so much easier to do. And then just briefly, we'll mention a little bit about dentures. Dentures is not a main part of my practice, although now with digital dentures coming on the horizon and the success that some of my colleagues are having with that may well be something that we start to revisit a little bit more. So very briefly about me. I am a general dentist. This is what I do every day. This is my practice. This is where I work. So I probably have the same struggles that you all do, dealing with staff, dealing with patients, running the practice. Those are all beautiful things that we all have to do. But I also spend a lot of weekends with teaching. Obviously in these COVID times, we've been somewhat restricted and we're limited to these online meetings. But our main aim is hands-on meetings where we can all get together and practice the skills and try and share the skills that really make our dentistry better. And I'm sure, like all of you, I can't wait to get back to those times when we can meet and share our experiences again. My disclosures are I've been doing this sort of dentistry for, I've been doing dentistry for 40 years. And when I was a student, all those 40 years ago, we had a aesthetic machine. I think we had a aesthetic machine before it was out in production. It seemed like a great idea. It didn't really do much of a job, but it was a great idea. And I've always stuck with that, thinking that this would be the future of dentistry. Well, it's not the future of dentistry anymore. It's very definitely the way dentistry is today. I don't think that if you've got a fair span of your career left that you can get through without engaging to some degree with digital dentistry. So this is where I am today. I still have a CEREC Blue Cam. I've not moved on from that. We use it occasionally now. And actually, we have a Trios 4 now, which we're using all day, every day. And that's the main part of what I'm doing. But we are engaged in digital dentistry pretty much every moment of the day in our practice. So when we look at digital dentistry, you know, and pretty much everything else we do in dentistry, we talk a lot about what we do and how we do it, when actually most of our ideas, they spread because of why we do these things. And certainly the why of why I do things in dentistry and in my education, and also with digital, is to try and get the best results I possibly can for these people here, our patients. And so that's what I want to try and share with you, is how we deal with our patients and use digital dentistry to get the best results we can. So let's take a look at someone like Gordon. And Gordon, you know, average patient, older guy, very worn teeth, you know, wants a nice smile. You know, his teeth are breaking down, but the way his teeth look is upsetting him. His grandchildren are making fun of him, and he would like a better smile, and he wants us to try and help him with that. So let's not make any mistake here. Digital dentistry is superbly important to us, but actually we should not forget the basics of what we do. And, you know, a complete examination is always going to be the basis of everything we do to make sure that we don't miss out what the patient needs. We want to listen to our patients to find out what they want, but we also need to do our complete examination to find out what the patient needs. My job as a dentist is then to try and combine those two things so I can deliver what the patient needs and give them what they want at the same time. So in our examination, we use a lot of digital tools. We've been using them for a long time. And certainly when we start to engage with our patients, we're going to use some digital photography. And you know, why do we use these, and why do we use our models, and why do we use our scanner? Well, we want to be able to engage with the patient, because a lot of the time, you know, unfortunately for us as dentists, we behave like dentists. You know, we talk dentistry, and we tell them they need mesioincisal distal fillings and things like that, when what we really need to do is engage with the patient in a way that's appropriate to them. And this, for me, is really one of the main things that digital allows us to do, because it allows us to access this new technology, which allows us to engage with them and give them motivation in order to move forward with the treatments that they'd like. But not only the treatments that they'd like, if we could do that, then we can access their underlying health needs. And by doing that, we can help them become biologically more sound, and we can also give them the function that they require to get these beautiful smiles, etc. So certainly over the years, we've used a lot of photographs, and we still use photographs to help motivate and engage our patients. I think they're still going to be an important part, but there's no doubt that being able to show the patient what their teeth look like really quickly in 3 dimensions really is a game changer. They are impressed by the technology. They are amazed, surprised, and sometimes somewhat perturbed by what they see on the screen. But we can start to show them how, you know, what their teeth look like, and we can also start to share with them our vision for how their treatment may well end up in the future. So sometimes I forget to talk about the simple things that we do, and taking those digital impressions and been able to use those to communicate with the patients is such a bonus. My background is a lot of functional dentistry, and we would take models, take impressions, then we'd have to cast the models, then we'd use a Facebook to mount the models, and a bite registration to mount the models, and it used to take a lot of time and a lot of effort. And now, within a few seconds of scanning the patient, we can be looking at those things together, and we have it there as a great record that we've checked to make sure that it's accurate before we start to proceed. Now, there are some things that scanners can't do, and we'll be very grateful that we can't do this. I've never had a scan that far down a patient's mouth. But most of the time, I think they provide us with more and more solutions. So this is what I want to do as well as talking about the scanners is to talk about the sort of journey for the patient and using digital dentistry to engage and motivate with them. So if we take someone like Gordon, we can take a very simple photograph and then using some very straightforward smile design program. This is one from 3Shape. You can get things like Smile Designer Pro, DSD, all those sort of things. We can show them very quickly, very easily, what their future smile might look like, how this might be. And this can be great motivation for the patient. I used to spend a lot of hours waxing up teeth, trying to show them what it might look like using Photoshop. Now it's so easy and so convenient to be able to do this. And we can do this ourselves. I can train an assistant to do this. We can work with the lab if you wanted to. With the advent of artificial intelligence now, we can actually use apps which will look at the shape and style of the patient's teeth already, look at their face, and suggest libraries that are going to be suitable to them. I think in the very near future, we're going to be seeing being able to have a button on our website. The patient will upload their picture, and they'll almost be able to look at their new smile themselves even before we've engaged with them. Much as you can do on, not that this is my area of expertise, much as you can do with hair colors and makeup, I think we'll be able to do the same with teeth really soon. I know it's certainly out there right now. So we can do our two-dimensional smile very easily. From that two-dimensional smile, that is not just a show and tell. It actually tells us about the length of the teeth, where these teeth might go. We can pick these libraries off the computer, and then we can use this information. Here I use the information to design where I wanted the incised ledges to go, set the vertical dimension, and then from there, we can share our pictures with the dental technician, and then we can share a scan with everything in place for him to do an additive mock-up. Because my next goal with this is to turn this into a three-dimensional scan. Now, this is where, for me, intraoral scanners and digital technology really start to pay off, because I would have to take these impressions, take the bite registration, take the face bow, send them to the lab. Now I can take these scans, they'll be with the lab in seconds, and then we can start our conversation. And the really cool thing about digital is, like we're all doing now, we can share this information with them, and then we can get on TeamViewer or something similar, Zoom, and we can discuss how we'd like to move forward. My view is that we all have things that we're good at, there's things that we might get paid for, and there's things that we enjoy doing. And the more that we do those things, the better we'll enjoy our days. So by all means, you can learn how to do all these things. I'm very fortunate I get to work with some great technicians. But by working with a technician and having a great relationship with them, we can utilize technology to be able to do this. And they spend their money on their programs. They're the masters of how this works. But I can share the designs that I like with them, and we can make sure that everything is just the way we'd like it to be. So we would send that over to them. We'll make a TeamViewer appointment maybe later in the day. This is how easy it is to do, rather than waiting 3-4 days for these things to happen. And now we can really start to see, this is Bruce from Sculpture Studios over in North Carolina. Again, another great thing. It doesn't matter where in the world we all are, we can communicate just as easily as if we were next door to each other. But Bruce is going to give me his design based on the ideas that I gave him, where I wanted the vertical dimension and incised ledges to be, share these images with me. And then once we've approved this, then, and I usually make a few changes just to make the technician feel as though I'm contributing in some way. As I say, I'm very fortunate, they're very skilled, so I don't have to do too much. But once we've done this, then they can send me the models. They can, instead of me having to wait, of course you can get them direct from the lab, but instead of me having to wait for these things, we can actually have these sent over as an STL file, and we can print them ourselves. Printing has just become part of our everyday dentistry. It's really simple, and it makes such a difference to our daily practice. We used to wait days, sometimes weeks, for wax-ups to come. Now we can have them done in hours and certainly in a day or so. So from that, we can print the file, we can print the wax up, we would make the stent. I'm sure it won't be long before we start printing the stents. But then I would use that stent in order to do a trial smile for the patient. So I'm sure you're all familiar with being able to place a trial smile into the patient's mouth, let them see what this will look like. So within 3-4 minutes, we can remove the stent and the patient can see exactly what this is going to look like. We can do the same in the lower arch, okay? And so this is the same deal in the lower arch. We fill the stent, place this over the patient's teeth. Obviously, there's lots of hints and tips involved in this if we had more time. And then once we've done this, we let that set for 3-4 minutes, and then we can remove that and we can see how this looks. And we can give the patient an instant 3-dimensional rendering of how their new teeth might look. And this is such tremendous engagement and motivation for the patient. You know, again, I would spend hours waxing up, maybe paying lots of laboratory fees for this to get to this stage. Now, digitally, we can move forward with these things very, very simply, very, very quickly, and very efficiently and cost effectively. So we can take Gordon from here to here in maybe 5-10 minutes. No, and then we get to see how this looks in the patient's face. How does he feel about it? We can see exactly the changes that we've made. We can then, always a good idea, we can check the vertical dimension. We can check, we've actually got the lower incised ledge in place. We have the upper incised ledge in place. We can check centric relation if that's the sort of thing you like to do. We can check our guidances, make sure everything is working the way we like, and we're well on the way to a successful result. Now, it's great for motivation and also for us to be able to see how this is live in the patient's mouth. Often they look a little bit lispy when we've just done the case, but we've made such big changes. But fabulous to be able to, for the patient to see where this is going to go. And this really motivates them, helps them buy in, not only to the treatment and turning up for their treatment, but also financially, which again was another big deal for me, you know, to have patients paying out a lot of money when they really didn't quite understand where we were going with this. I think now being able to get motivation, being able to get consent, and good informed consent about what they can expect from us, I think digital really raises the bar as far as that's concerned. We also use it, you know, it's good. Our technician friends, they never get to see the results of their work. So this is Gordon, just made a little video for Bruce, just to say thanks very much for his part in sharing this with him. But it's always a great way as well to see that things are functioning and working well, and that if we move forward with this, we're going to be successful. So, you know, very often with someone like Gordon, we might need to stabilize the bite first. And making splints, again, well, that was a pain in the neck for me for a lot of years. You know, we would have to take all those models and we would have to mount them, use acrylic. You know, it was smelly and it was horrible and it was not very nice for anyone. Now, we can take our scans. I like to take the scan at the right vertical, depending on what sort of splint I'm using. That sort of negates the need for a face bow in these situations. And we can design the splint. Again, you know, using some of the softwares out there. This is one from 3Shape again. But, you know, I can design these splints myself. We can print them ourselves. It makes the whole process so much easier. And again, another service that I can provide. You know, splints is not the focus of where I want to go, but it's a necessary thing that I need to do in order to get the results that we would like to achieve for ourselves and our patients. Another cool thing that we can do is we take the scans, and this, you know, I wanted what we call a 3-piece splint. Takes a little bit more knowledge than I have for the design. So I'm able to take those scans. This was actually sent to one of my lovely Romanian colleagues, Irina, and she would do the design for me. I can check the design, make sure everything's just the way that we would like, and then she'll send that over to me. And again, we can print the splint. Printing splints is becoming something that is becoming very, very easy to do. We used to mill our splints, particularly we could print them for shorter term, but we used to mill them. When I first showed this video that I'm showing here, I think it took almost 24 hours to mill the splint. Now we can have this done in just a few hours, and we can get some beautiful results with milled splints. This is one of the splints that I have from my good friends at Cosmodent Lab in Malmo in Sweden, from Chemek over there. But the fit of them is just superb. It's better than, as good as, if not better than, anything I've ever had in the analog world. The function is beautiful, and it just makes my life so much easier. We used to, if we were using shorter term splints, then I might print them. Longer term splints, we would definitely mill them. But now with some of the new materials that we have, we're having great success printing a lot of the splints. And this is a 3-piece splint that we made, one that Irina designed for me, sent it over to us, and we can print it out. Once we've printed that out, section it out, we can polish it up. I'm a little bit lazy with the polishing sometimes, but just to show you how well these things fit, you can see this is one that we made in 3 pieces, but it adds to the fact you can see how well it fits. But the fit is superb. The function of them is excellent. The really cool thing about it, if the patient has any problems, we need to remake any parts, it's so easy for us to do because of the information that we've already gathered and saved. So this is another really cool thing that we can use our scanning and digital dentistry for. Just to change tack a little bit, move to something a little different. Again, it's not one of the main focuses of my practice. I tend to treat mainly adults, but it's still got a role to play in that. But certainly as a general practitioner, one of the things that you can do and we can do is we can scan our patients on a regular basis. I definitely would not want to be taking a set of models every year when the patient came in, but taking a scan maybe every year or so is a good idea. We can use it then to monitor what's happening. So we can use this for patient monitoring. This is a great thing that we can show patients if they're getting more and more wear to their teeth, maybe recession around the teeth, changes to the teeth. We can use it to monitor our orthodontic treatment so that we can see where the teeth are moving, how the teeth are moving. So these are really cool things that we can start to do with the monitoring systems that digital makes it easier for us to achieve. This is a little video that was shared with me by my friend Martin Hayden in Denmark, but we can actually monitor the development of patients. And again, this is a really cool thing, and I think enhances not only the patient experience, but also enhances our education and knowledge about the way things are changing for these patients. So these are really cool systems that we can use. The other thing about this, when it comes to, it's a word that I don't like to use, but maybe selling dentistry, is you don't have to sell anything. The patient can see the changes that are happening. If their teeth are wearing down, the pictures will show them where they're wearing, it'll tell them how much, and then hopefully they're going to be asking us, well, what could you do to help me with this? So that's one of the things that's in there. One of the things that I do use a lot, and we use this, I got to say, every day, several times a day, is actually in-house milling. And this was something that I used to use my CEREC machine for. This was the main part of why I use that. Now with 3Shape and Dental Desktop and our Program Mill milling machine and lots of other things are available. There's plenty of different choices out there. But we're able to design and mill crowns and inlays and onlays, and a lot of the patients that I see require these sort of restorations. And obviously we're very, very careful. We need to make the designs as perfect as possible. It needs to be as good as a lab. But a lot of the time, particularly with large adhesive restorations, it's so convenient for me and for the patient to be able to mill these and then just have to glue them in. It makes the whole process so much more predictable and so much more efficient. I think also as well, a lot of these things we would think about being lab generated. I think the fact that we can do this for the patient, they don't have to come back, they don't have to get numbed up again, we don't have to open the tooth up again. All these things have got to be good for the tooth, they're going to be good for the patient, and they're definitely good for our productivity and efficiency within the practice. So, there's a lot of cool things, again, little things that sometimes I take for granted and forget. So if let's say we want to try and find, it's difficult on a margin on a tooth and we get some retraction, but it would be easy to lose that as we start to take the impression. Well, we can impression that tooth, lock that margin into place, and then when we scan the rest of the arch, we don't lose that information. I mean, this is incredible stuff. It was so hard getting good impressions sometimes. Maybe, I think it also improves, it makes it easy for us to trim models, but I think it also improves not just our margination, but it also improves the standard of preparation that we're able to do. Because I know you all do amazing preps. Occasionally when I prep a tooth and I'll take a scan and I can see that maybe I've left some bumps around there that I don't particularly like, it's very easy for me just to take away that part of the margin, re-prep that part of the tooth, and then rescan the margin. And we can get beautiful, beautiful results by being able to do that. And it's so convenient. And one of the things, again, when I was younger, we were trained much to not to our delight, to trim our own dies. And the idea was that we knew better where those margins were. Well, certainly, if you've just prepped the tooth and you can know where everything is, being able to mark the margins on the tooth is a great advantage. And you can do that with digital dentistry. You can see there's no escape from your dentistry anymore. Some of you might not like that, but it's actually a really important thing to do. And it's going to make you so much more efficient because we're able to do that. So, but you can see where those margins are, and we can, whether you're making the crown or whether you're sharing that with the technician, that's going to make our lives so much better. So let's look and see how this comes together, looking at patients. So we look at someone like Meredith, and she'd suffered from bulimia. She had these worn teeth, eroded teeth. She wanted a beautiful smile. She had some problems with her joint. She wanted to stabilize the bite. I'm sure you can imagine it's a pretty long story in itself, which we're going to have a real short journey through at this stage. But she wanted us to make this as beautiful as we can and make it as stable as possible. So, of course, where do we start? We always start with our complete examination. And, so we're going to check her teeth, check the perio, check cancer, all the things that I mentioned very, very briefly before. But where do we go from there? Well, we needed to control her bite with a splint. So we made her a splint, just the way we showed you previously, stabilize their bite. Now, once we've stabilized that bite, I want to move forward with her treatment. We had discussions about whether this was going to be porcelain, whether it was going to be composite. She was desiring that it would be porcelain. She's an American lady. I know she's a very intelligent lady, though, because she married a fellow Liverpudlian. So I know she's smart. But she wanted porcelain on here. We could have done this with composite. Once we understand the design, the choice of the materials and the procedure is between you and the patient. But we have to understand what that design is. And again, digital dentistry is tremendous in allowing us to being able to work out what that might be. So from here, we can move forward. But this is what our teeth look like, just so you can get an idea. My biggest concern was that she might want this at 50% off because she'd already prepared her teeth. We take our bite registration, we take our impressions, we take our bite registration, but this is how easy it is to take a bite registration in the digital world. I mean, I've been brought up with wax and then PVS, and it's difficult, and then you have to mount it and maybe problems arise. Now we can take those bite registrations. We can take a loop with a looser jig, we can take it with a leaf gauge, we can take it with manipulation. But I can take the bite record and I can check the bite record straight away. This is such an improvement on where we've been. Very often, if I mounted those models, I would need to wait a few days before I could check where we are. So straight away, we can check, we can compare our first point of contact on the models to our first point of contact in the mouth. The easiest way to do this is to to find your first point of contact, mark it with articulating paper, and then scan the patient. And those marks will show up on the scan. And it makes it super, super easy to make sure that we have got the lower arch located correctly to the upper arch. Massive improvements on where we were in the analog world. Now, once we moved on from splint therapy, I wanted to give Meredith a bite that was going to be stable for her. I didn't want to move straight to porcelain because I was concerned that she had some problems with her joints that were now stable, but I wanted to make sure that that stayed stabilized with the restorations. So we wanted to go to an additive mock-up so that I could make individualized temporaries for her. And this is a few years old. This wax up, again, done by my friend Chemek at Cosmodent in Sweden. Probably irrelevant in some ways, but it reminds me of the power of digital, because this is Chemek showing me where we need to do some crown lengthening. But I was doing a lecture in Bulgaria, so you've got a British guy in Bulgaria, and my phone dings, and I get a message, and I can now look at the design from Chemek, who's in Sweden. So this is really the way dentistry needs to be. This is a great, great communication tool, rather than things going in the post, maybe never to be seen again, or arriving several days later. One of the things that sometimes we forget with digital dentistry is the immediacy of what we're able to do. So Chemek is able to share this wax up with me, and then I can check it with him, make sure that it produces the aesthetic appearance that we would like, that we can then also make sure that we have the function that we need. So if we left this video run longer, you would see him putting this onto the virtual articulator and checking that the function is exactly what we'd hope to generate. So really cool ways we can see exactly what we're adding on, so we can see how the teeth underneath relate. Just fabulous, fabulous information that we can get from our scanner and from digital dentistry. So this is, we don't need to print all these models. I did this mainly for demonstration purposes. We've got the original model. We have the full wax up that we've done. And also this is a very useful thing to do, which is called if you're doing this sort of case, what's called an every other tooth model. Again, this used to take quite some time to generate. Now we can do it at the press of a button, and Chemek can send me both of these. And every other tooth models allow you to place individualized temporaries really, really quickly and efficiently with good morphology. So this was the lower, this is the upper, exactly the same. Now on the front teeth, she already had some veneers. We needed to cover the palatal surface. These are the stents that we made from the printed models. Going forward, I think now even, but certainly in the future, we will be able to print these stents, and we can actually cut out that middle phase again. These were some clear stents that we made so that we can make the composite. Again, we're starting to be able to print the stents with great accuracy. We can actually print the pieces and just glue them on, which is making life easier and easier all the time. So here we made some provisionals for the upper anterior canine to canine, where she had the veneers already. This is more of a sort of traditional technique, as you probably understand, using the stent. But the other cool thing is now that we can prepare these. We can actually print our temporaries and have them ready, so that as soon as we prepare the teeth, we have the temporaries ready to go on. This is particularly useful with longer treatments, maybe like implant treatments, to make sure that maybe we can use materials like PMMA, etc., which are going to be a little bit stronger for longer term usage. So I use this every other tooth now to do some injectable molding on the teeth. So we're doing every other tooth, and you can see, I know all you good people could create this sort of morphology freehand and very quickly. This would take me forever, if at all. But using the digital wax up, we could place the temporaries. We could do the same thing in the whole mouth. You can see here's the lowers, here's the every other tooth, and then this is the whole arches in place. But everything is individualized. Everything is easily cleanable. and we can make sure that the patient is going to be stable with their bite and their occlusion. Fundamentally, I am a functional dentist. I like things that work well, so we always like to check that the occlusion is correct. Again, I have to say that with our digital wax ups and the way we're able to work now, the accuracy that we're getting is just superb. Can we prove these things? Well, I'm sure proof will be given over time. As a wet-fingered dentist, if that's a term that you would understand, just using these things every day is making my life so easy and much more predictable. We use T-scan to check that the bite is right. This is sort of digital articulating paper, and this is actually the bite before I'd made any adjustments, and it's pretty much bang on straight away, which is pretty unusual. Nice when it happens, but it's becoming more and more the way it is with digital technology, because it just seems to be working better and more predictably for me. So now we have the patient stable. We have the patient stable in provisionals. I like to move forward in a stepwise fashion, so we could remove the anterior 6 restoration temporaries, rescan the patient. Really nothing in the need of preparation because the patient's already prepared their teeth. And Shemek is able to make me these taco shell Emax veneers, all made digitally, CAD/CAM restorations, send them back to me, and we cement those into place. We did the stitches on the top is because we did a little bit of crown lengthening, old school, to try and improve the gingival contour around those teeth. But people say that you can't do minimally invasive dentistry digitally. I mean, that is not the truth. I mean, you do need to know what you're doing. You need to work with a good laboratory, of course, but with the right people, we can get beautiful, beautiful results. And we can actually really understand, hopefully, if I can skip through this presentation quick, you'll see at the end, we can know exactly how much space we have for our restorations to make sure that everything is going to work really, really well. So again, we can take our scans of our preparations. I just wanted to show you, this is a few years old, so this is an old scan. Things are even quicker now. But like I was saying before, I mean, this is so cool to be able to do this. I mean, this is 10 restorations. If I was doing a full arch or a lot of restorations, if I missed something, then in the analog world, I'd have to redo an impression, take another impression, a real pain in the neck. Whereas with digital, if there's something that I don't quite like, we can go in, we can just wipe that out, rescan that area, and it makes the whole deal so much better. I would hate to be without my scanner now for these procedures. And the accuracy of fit and everything else that we do is as good, if not better, than where we were before. We can scan the provisional restorations, the approved provisional restorations, send those to the laboratory, makes the communication super efficient. They can lock those provisional restorations over the preparations, and then they can see exactly what space we have, make sure that we've done enough work for them so that they can produce the restorations that we need. And then we can move forward to those final restorations. Here we have just still got provisionals on the upper anteriors where that crown lengthening was in place. And here she is before, and there she is afterwards with everything in place. Everything was done digitally, never left the computer screen. Makes life so much easier. So just as a brief word, in case I forget to say this, I know investing in intraoral scanners is a big chunk of change. It's a lot for us to do. I have to prove to my accountant and practice manager that we're gonna get a return on this. Use simple things. I mean, first of all, get involved. I mean, maybe just work with a lab that's going to scan your impressions, and you can access a lot of the things I've shown you already. Maybe someone who scanned your models, and you can access some of these things that we're doing already. But very soon you'll see that if you just were able to make your splints, were able to make your individual posterior restorations, intraoral scanner is going to pay for itself in no time. I think sometimes as well we forget the fun and the excitement and the predictability that it brings to our everyday dentistry. And this is one part. This is the part I alluded to it before, but it actually makes implant dentistry so easy to deal with now. And I used to sort of dread taking these impressions. Now the patient comes in, we take the temporary off or we take the cover screw off and we scan the emergence profile. We mark where that is, and then we put the scan body in. And all we have to do then is scan the scan body, take the bite registration, and the implants come back. I screw them in, and I almost feel like a little bit of a fraud because it's so easy. Again, you need to know what you're doing. The lab needs to be a great lab to be able to do that, but there's plenty of those out there now. We see things like this. I don't do too many full arches, but whenever I engage with a digital procedure, we would copy it in analog first, and then move forward with the digital part after that to make sure that everything was working just as good as the analog. We are very successful now with these, and again, it makes my life so much easier working in this digital world. A little bit about orthodontics. This is a program from 3Shape called Treatment Simulator. It's just one of their excitement apps. And really what it does is you scan the patient's teeth, and if they're interested in braces or they just want their teeth straightened, using artificial intelligence, in a few moments, it will generate what their teeth would look like looking straight. I'll be honest, when I got it, I thought, well, what use is that? No one's going to be impressed by that. And I've been amazed at how many patients thought this was fantastic, who then engaged with me for having all sorts of orthodontic treatment because they'd seen what their teeth could look like if they were straight. Now, this is again an older case. Laura, actually, you can imagine this is a long case. I'll try and tell you real quick. But again, being able to scan a patient like this now would make it so much easier to do. She wanted me to prepare all her teeth for veneers because we'd done it for one of her relatives. She was getting married in a year, and she just wanted a quick fix. She told me something that you'd probably never heard before. She didn't like dentists, so she just wanted it over with, and she wanted to look great for her wedding day. I always say to them, I want you to look great for your wedding day, but I also want you to look great for your next wedding. So we want this to last a long time. So long story, very short, we managed to persuade her that orthodontics was achievable, that maybe we could do it with clear braces. And again, by being able to scan the patient and then send this to in this case, it was Invisalign, we're able to share with her an idea about what we might be able to achieve and about how long this could take. And this is huge motivation and engagement for the patient. So much better. In the old days, I used to have to saw the teeth out, etc., to be able to do this. So here she is, just 10 months later, very happy. Obviously, there's room for improvements in lots of different ways, but I think this is a very acceptable and very reasonable result, and much better than taking a bear to this lovely young girl's teeth. So now things have moved on considerably. Now we can not just scan the patients, but we can start to do a little bit of orthodontics ourselves if we like. So we can use systems. This is, again, apologies for it being mainly 3Shape, but other systems are out there. But this is the ortho analyzer system, the clear aligner system. But these little anterior alignment cases, we can scan them. We can use this software or get the lab to do it for us, if that's a more appropriate thing. We can know exactly the space that we need to create. We can look at how long it's going to take. You can see here, we put the clock on, just took us less than 3 minutes. This is shared from one of my colleagues, Neil Harris, who's really adept at this. But in just a few minutes, we can have this set up. We could generate the models, generate the aligners, and think about how productive that makes you in your practice when you're able to offer these things for the patients as quickly and as easily as that, and what that might do for your bottom line as far as your return on the investment. So another really cool thing you could do, if you like brackets or it's a more suitable case for brackets, then we can take our scans. The lab can help us with our digitally placed bracketing system. These are from my friends at IAS Academy, and we can use these matrices that they make for us to place the brackets with superb accuracy, making sure that we get everything just right. So I say I don't do a great deal with dentures. Again, these are shared by my colleague, Martin Hayden. But here we are with a scan that we're able to mark up on the iPad what it is, what sort of design that we'd like. The lab can use the technology to do the design and print these things, and just amazing results that we're getting. My pal Lee Culp over in the States, big into digital full dentures, particularly as a precursor for implants. Tremendous results with those. I'm even thinking about doing a little bit more with that myself, because of the accuracy and the results that we're getting in that area. So what I hope to share with you is the fact that we can use this in lots of different ways. Now, to finish off with, I just want to show you some slightly more complicated things that we do. And I'm going to show you that mainly for the reason that if it can do these complicated things, hopefully it can do the simpler things that we need on a daily basis. We can combine the intraoral scans. We can combine it with our face scans. We can combine it with CBCTs. We can combine it with jaw trackers and things like Modjaw, where we can actually copy the function of the patient, and we can copy the perfect motion of the patient to make sure that we get the beautiful function that's going to make our restorations last a long time. So yes, we can do virtual articulation like we're doing using a photograph here to mount it on a virtual articulator. Old school, we got to remember that an articulator is really just the best guess we can get. It's taking a biological system and making it into a mechanical system, which it's not. With things like Modjaw, we're now able to copy the exact motion of the patient to make this even more accurate. But you know, whatever we can do in the analog world, we can most definitely do this in the digital world now. And I would argue maybe for the better. So just to finish up with one case that shows some crazy things, just to excite you perhaps, or maybe think that this is the way digital dentistry is, and if it can do this, then it could help me in my daily routine. Let me just show you very quickly Amy, one of our patients. Now, you know, we talk about the most important thing being to engage with the patient. This poor lady had some misshapen teeth through a genetic disorder, and she had orthodontics, been going to the orthodontics at the hospital for 14 years. But if you asked her the question what the problem is, she would say, I don't like my face. You know? And if someone wants to change their face, something like this, she had airway issues, she had tooth issues, she had facial issues, she had lots of things going on, but this is more of a surgical solution that we might need to look at for her. Now, this is not a pretty smile by anyone's standards. You know, as a young 20-year-old lady, I'm sure most of us would appreciate this is not where she wanted to be. I think as dentists in dentistry, I think we should be ashamed that this is what we are able to provide for our patients. You know, and this is a well-motivated patient. So you can see that we have a challenging situation here. You know, we have missing teeth, we have misshapen teeth, we have small arches. We really need to do a lot of planning here to be able to get the success that we need. It's going to be an ortho surgical restorative case. I'm just going to scoot through, but this is, again, when we talk about interdisciplinary dentistry, this is one of the coolest things, to be able to communicate with our colleagues, that we can share all this information. We can all work on the same case and make sure that we're getting the results that we know our patient would like. So this is our predicted outcome with our surgical techniques. This is the airway prediction that we have from our CBCT. You know, you may not think so, but Amy, having a lot of airway issues for a young lady, one of the things that we can get. And by doing the surgery that we wanted, it was also going to improve her airway predictably and tremendously, which I think is going to make a big, big difference for her as time goes on. Once we got through our planning, she promised me she was going to get rid of that ring if we did a nice job for her. But once we got through some initial preoperative ortho, We put some temporaries on to help the surgeon and the orthodontist understand where the teeth need to go. You'll notice that there's a cant there. That's deliberately left because in the surgical phase, we're going to change the way that cant is. So now look at how cool this is. We can combine the face scan with the CBCTs, with the intraoral scans, with the restorative dentistry, and we can really start to understand how this is going to look for the patient. And like I say, surely if we can do this, then we can do our simple little crowns and have them looking beautiful and accurate. So this is what we did. We can plan where the cuts need to go. We can plan any enhancements that we need to do. We can make the splints and the guides that we need to position the teeth post-operatively. This is our predicted outcome, and this is our 6 weeks post-op outcome. Very patient, very happy, still a little bit swollen there. Now, this is one of the cool things. I'm just an ordinary guy. I like simple things. One of the things that really bugs me with working with orthodontic patients is trying to take impressions with brackets on their teeth. Well, now we can we take the wire off, we can scan them with the brackets on, we can do a virtual bracket removal, and we get almost a perfect impression. Now I can do the wax up and we can work out exactly what we need to do to finish the case off. So it's a little thing, but it makes me happy. That's probably because I'm quite sad. So we're able to, once the orthodontics is done, take the brackets off, put the temporaries in, make sure that functionally and aesthetically we have everything the way that we'd like it to be. We can see here, this is the additive mock-up that we did. I've scanned the patient with the provisionals on. We have a scan of what the teeth are underneath. And now we can digitally, we can check out what's going on there. This is Shemek helping me again. But we can take cross sections through the teeth. We can see where we have enough space. We can see where we need to create more space. So, I mean, it just adds so much to the predictability and the efficiency of what we do when we know exactly where we're heading for treatment. It's just a different world in there. Okay, so these are the really cool things that we're able to do with digital dentistry. So this is Amy before, 6 weeks later, and this is her before, and the smile that we're able to create for her. And she's very, very happy. She breathes much better. She looks great. She's got a lot of confidence. Hopefully a pretty successful result for her. The reason to show you that is, say, not, maybe it's not something that we do every day in dentistry, but it just shows you lots of little bits, lots of little advantages of digital. And for me, if it can do these sort of things predictably, then surely it can do the simple things really predictably as well for us. I am a very, very fortunate guy. I really rely heavily on my colleagues, particularly these guys here. This is Alberto Canabeth, my orthodontist. Inigo Destada, who placed the implants, our periodontist. Shemek, Lee, and Phil, who are tremendous technicians and digital technicians. And without them, you wouldn't see the work that you see today. But the coolest thing about digital is that we all live in different parts of the world, but we can communicate as if we live next door. And that has only got to be good for us, got to be good for dentistry, and got to be good for the outcomes for our patients. Too often in dentistry do we find a situation where people not only are not working to the same goals, but they're also not working to a same plan. So one thing I'd like you to remember is technology is a great servant, but it is not our master, and we need to be able to use technology. So first of all, remember your basic dentistry, remember all the things that you've learned throughout the years, and then use the technology to get the results that you'd like. That's the end of my presentation. I will check and see if we have any questions on here at the moment. So that's my email address. If anyone would like information, I'd be very happy to help you. One question that I've had so far is, do I need to understand analog before I start with digital? Well, I think it's a good idea. Technology will never save you. Those of us who've been in dentistry for a while will hopefully tell you we have bought several things over the years. We all thought it would be simple to put the patient's head into this apparatus and it was going to give us the answers. The most important thing to invest in, maybe for the sake of sales, I should say intraoral scanners, but actually the most important thing to invest in is yourself and what goes on up here. And then we need to make that into hand skills, and the technology that we use just helps us to be able to put that into action. So technology is a great way to move forward. I think it makes our days more predictable, makes us more efficient, makes us more productive. I think it makes more fun. I say I've been doing this a long time. I'm excited to come to work most days and be able to do this sort of dentistry. I've got a new printer waiting here for me to take out as soon as we finish with this. But so it makes our information and our engagement with the patients even better. Another question we received is, what sort of scanner would I recommend? Scanners are like they're like impression materials. There's lots of great ones out there. I have used CEREC for years. I think that's a great scanner. I'm very much like my 3Shape scanner and the Treo scanner. I think that's great. But there are other scanners out there. The best thing you can do is find the one that's going to be a fit for you. So get with a company, get someone who knows what they're talking about, have them show you how that's going to work. Get a trial in the office. Make sure it's going to be suitable for you. Have a think about what you're going to do with it. That's an important thing to consider as well. That if you want to mainly concentrate on in-house milling, that's one story. Maybe if you're doing a lot of Invisalign, that's another story. So think about what it is that you're going to use it for as well. That's going to be a consideration that you might want to think of. One last question, and then it's time for me to wrap up, which is printing or milling. Which one is better? It depends what for. Again, I think, traditionally with restorations in particular, we've been using milling. That's been our most predictable way of doing this. I say with splints, it was milling, but now we're able to move forward with printing. And printing, I think, offers us a lot of opportunities, offers us maybe more freedom. We did a little research now with printing. I think we can print sort of 80 crowns on one platform. And not that you'd ever do that, but it just makes it so easy and so efficient and productive to be able to do that. So I think the way forward is going to be printing. I think it's a very economical way of doing it. I think at the moment, if you're in-house milling, in-house production, milling is going to be still an important thing for quite a while. There's always going to be great materials in there. I've just invested in a new milling machine, so I must think it's got some future. But I think at the price of printers, I think there's so many things you can use them for. I think that is a really cool thing to be doing for the future. So with that, I think we have about 2 minutes left of this hour. I hope it's been useful to you. I hope it's been a little bit entertaining. I hope, if nothing else, you can garner my enthusiasm for digital dentistry and for intraoral scanners. Like I say, please don't feel obliged, to get involved in digital dentistry. You need a scanner. I know it's a big investment, but I do think, I'm absolutely certain that if you get with a lab where you start scanning impressions and scanning models and start to see the benefits that I've tried to show you in this last hour, that you would see the efficacy of getting your own intraoral scanner. With that, I just want to finish up, say thank you to Haley at Dentology for looking after me. Thanks to all the guys at Dentology and Shine for putting this on. And I wish you all a very successful meeting. Thank you very much.